think we're at a 160, so we're gonna get started. Let me start by welcoming everyone and just saying thank you for being a part of our webinars. You know, we do 2 a month, and it's an honor to be in front of you, all of you. My name's Vincent Medley. I am the Maddie's Director of the Human Animal Support Services Project. And tonight's discussion is on intake, animal intake, and the Haas model. And let me review, before I get started, a few housekeeping notes for you. So in Zoom, you'll see a Q&A option at the bottom next to the chat option. What we want you to do is to please use that Q&A option for any questions that you have for the panelists. Don't put your questions in the chat. Please put it in the Q&A because that's the mechanism we use to know what questions you have and to answer the questions, and it helps us track. Then also, you can use the chat to engage each other throughout the webinar. I'll be in the chat, the panelists may be in the chat a little bit, but we really want you all to engage and dialogue with each other in the chat. We ask that you stay on topic in the chat though, so that when you, so that we're all on the same page and the conversation stays robust. And also, if you want to chat when you are chatting in the chat, make sure you have clicked onto everyone if you intend to communicate with everyone. Obviously, there is also a drop down for the panelists as well. But if you want to talk to everyone, make sure that you click everyone in the chat. Please stay tuned to fill out a brief survey at the end of the webinar. And then also, lastly, if this webinar is being recorded, so just keep that in mind. And it'll be distributed within 3 days to the email you've registered with. If you do not see any in your inbox in the next 3 days, please be sure to check with us. Check your spam first, but then also visit humananimalsupportservices.org/webinars to get a copy of the webinar. All right, so all the housekeeping is done. Oh, one more housekeeping note, just to let you know, I generally have a shirt with a collar on, but I'm wearing my Haas t-shirt today. So if you'd love to get yourself a Haas t-shirt like I have on, please go to the Austin Pets Alive store online to purchase yourself a Haas t-shirt. Anyway, now let me introduce tonight's topic and our other panelists. Our webinar tonight is Animal Intake in the Haas Model, the Vision, the Myth, the Revolution. So we'll have the opportunity to speak with some incredible leaders, 2 very incredible leaders, and I've had the privilege being in this industry for so long. I've been able to meet some of the coolest people, and I've been knowing both of these people for over a decade. Jorge close to 2, Ellen close to a decade and a half, and I'm so honored to have them join me. The president and CEO of Austin Pets Alive, and one of the founders of the Haas Project, Ellen Jefferson, Dr. Ellen Jefferson, and also along with her is someone that I worked with for a long time when we were both pups and little, just starting out in the business, is the Animal Services Director for one of our Haas pilot shelters. It's Guilford County Animal Services, Jorge Ortega, and I just want to welcome the 2 of you to tonight's panel.
Thank you. I love the pups, young pups. Yeah.
We were pups.
I know.
We both didn't. Neither one of us had gray in our beards at that time.
No.
Did
I
we
still
even
have my
beards?
beard. I don't know where your beard went, but I still have mine. So
I know that was back when we were still tucking our boots into our pants into our boots like we were, like the SWAT team, and thought we were really doing something. Anyway, so it's great to have everybody here tonight, and we're going to. Tonight's, sometimes we have presentations, but tonight it will be a panel discussion. And I'm going to queue up 2 people that are very much attuned to what the topic is tonight, and we're just gonna have a discussion about, and we want to have it in front of a national audience, and we want you to share in that discussion through your questions and also through the chat. So I wanted to start out tonight with Dr. Jefferson. So when we talk about animal intake, we know that's a controversial topic, and especially when it comes to the Haas model. And there's a lot of misconceptions around it, which is in our title. What was the origin, the original vision for the shelter intake at Haas, for the Haas model back in 2020? And then how did it become so controversial in your view?
Yeah, great question. Back in 2020, when we first started all this, we envisioned a world where there was more support, more emphasis on the intake process. And my background with Austin Pets Alive was really focused on the outcome process and what was happening to animals that were exiting government shelters. We never looked at the intake part of it. And what COVID allowed us to do and allowed the birth of the Haas model is really take a look at how government shelters in particular are interfacing with the community and what's happening in terms of intake in groups of animals, reasons why they're coming in, areas they're coming from, all sorts of stuff that some communities have looked at for a long time. And I suspect Jorge is one of those, but many haven't. And it's something that needs a lot of attention. So the idea back then was that intake becomes more of a point of entry into the system. And entry is not necessarily the animal coming in, it's more of a launch pad for a conversation to help whoever is on the other end of the leash, help them overcome whatever is their obstacle. And that might be that they just need to get rid of this animal, and or they need to drop off a stray they found because they can't hold it. But without that conversation happening, which many shelters have struggled with because lack of resources and lack of knowing how to navigate that. Without that happening, it's just a revolving door. And so what COVID, I think, taught us was that a lot of those animals, a lot of people care about the animals that were coming into the shelter. And when shelters were closed because of government mandates, we saw people coming out of the woodwork to help animals. And that's just something I don't think any of us have really ever experienced before. And the idea was, well, maybe we need to look further into this. The controversy comes from how hard it is to do that, and how hard it is specifically for shelters to do that, because it's new. It's a completely different way of operating, and so having the resources, having the training, having the support to be able to make decisions in the moment and do that critical thinking right at the desk is it's hard. And so a lot of shelters that are trying to do it are struggling with the effect of potentially not nailing it right away and having animals be turned away completely. And of course, there's some shelters out there that just close their doors and they're not paying attention to what they should be doing or shouldn't be doing. Hopefully those are in the very, very, very small minority.
And as you're talking, Dr. Jefferson, it reminds me a lot of the model that was used, the TNR model, where the reason why the cat populations exploded was because people were ignoring the populations and didn't have a program. So, just to dive deeper into your thoughts, what do you say to people who say, no, Haas is about shutting doors? Because we hear that a lot, especially nationally. It's about shutting the doors and telling people just keep the animal or let the animal go. How would you respond to that?
That's definitely not the Haas model, is what I would say. And I think that I would say to really try to understand what we're actually trying to accomplish and differentiate the bad apples or the bad processes. It may not even be people that are intentionally hurting animals or turning them away when they're in need, but it's hard. I mean, we are on a cruise ship. This institution of animal sheltering is a cruise ship. You don't just turn that around like a little speedboat overnight. And so I would just say that try to get more information and understand how you can help make this a better system.
Yep, that's so important, and it makes total sense. There's a plan for every animal that comes in. Even if that plan isn't necessarily always mapped out, there should be some clarity amongst the agency as to how to route that person. And never have we ever said, you know, to tell somebody there is no answer for you, go away. It's how do we partner and leverage? Would you say, you know, because to me, the Haas model is about leveraging a lot of the work that the community either is already doing or work that they're willing to do. It's not about forcing anyone to do something that they don't want to do. How would you speak to that?
Yeah, absolutely. That's 100% true. And what we found, you know, we saw anecdotally that people wanted to help, and people weren't necessarily wanting to bring their animal to the shelter, but felt like they had no other choice in previous days. And there was a study we did through Haas that was called the intake triage study. And we had our data embeds go to, I don't know, half a dozen shelters and just stand in the lobby and interview people as they came in. And we found across the board that 37% of people standing in the lobby, whether they had an owned animal or a found animal, were wanting to help that animal by keeping them in their home, either until they found another home, or they were reunited with their pet, with their owner, or for even up to 2 weeks while the shelter made room. So we see that there's a lot of interest. One thing I'll add, and I want to get Jorge's thoughts on all this too, which I'm sure you do too, but I would just add that I think we have the term intake, when we talk about the intake desk and the intake lobby, it's a predetermined outcome of what's going to happen when somebody walks through that door. And so we've been communicating to the world that they should bring their pets to the shelter if they have a problem. And it's a message that I think is getting better over time, where we're saying, hey, there's other solutions out there, but it is one that we need to keep really being diligent about. And I would advocate for getting rid of the word intake, not because the process of intaking animals into the shelter goes away, but because there needs to be a stronger, like a counseling session or a support services lobby or something.
Yeah. Go ahead, Jorge.
Yeah. So standing in the lobby, you mentioned Dr. J standing in the lobby. So for us, standing in the lobby, when we started that Haas collaborative and having the conversation and sharing with our community that we were a Haas shelter, and everyone started learning what that meant, we did get some negative feedback, like, are we not going to do this and are we not going to do that? So we had to message it wasn't a no, we're not going to do that, it's that we're not doing that now. So it was a no versus a not now. So it was either delaying the intake, diversion, you know, can you help us with fostering? It wasn't, we had to shift, we had to pivot because the community wasn't accepting the change in intake like you were talking about. But going to the lobby, for us, it's been really not just about the animal, but really about the human. We have been partnering with our county, you know, other departments, DSS, DHHS, COC, and bringing them, Family Justice Center, bringing them in to our lobby and seeing where these individuals are coming from. So it's really not just about the cat or the dog, it's really about the person. So we're trying to provide resources for the individual, as well as we're trying to provide resources for the pet at the same time. But it's really not about shutting doors. It's really about opening doors and opening innovative doors. It's opening new doors to partnerships. It's opening new doors to sharing of information of the why do we have owner surrenders by appointment. But if you do find a stray, you can bring them straight in, we'll help you out, but then we'll have the conversation with you. Are you willing to foster? We have a program that we call Stray to Foster. And then we'll provide you with crate, food, we'll vet the animal. Some of those animals end up being adopted by the finder. So it's really about not closing our doors is just slowing down so we can, it's just like an emergency room in the hospital, right? As soon as you walk in through the door in an emergency room, they don't just throw you back there into a room. You have to wait until you're called. So we're trying to do that. We're trying to provide speedy services for those folks who are just not, you know, you have to take this dog. There's those instances, we'll take the dog, but then there's those times where we're like, can you give us 15 minutes while we work this out? Or can you wait 30 minutes while we'll, you know, fully work up the dog and we'll give you the crate and the bed, and are you willing to take them? Being a municipal shelter has been challenging. My background has been nonprofit. I think when I worked the time that I was in Charlotte helped me see and understand that community work was just as important as working in the shelter and understanding our community needs and seeing where our animals were coming from. That's when I really started focusing on GIS data, working with animal control, where their calls were coming from, focusing why the calls were coming in, why their stray intake was so high. So my time in Charlotte, working with the Humane Society of Charlotte, really kind of helped me understand community work was really important. So when I came to Guilford County, that's when we started changing our intake process. And that's why I raised my hand when we started talking about Haas in 2020, is that I wanted to be part of this change, knowing that it wasn't going to be pretty and there was going to be a lot of work ahead of us.
So it sounds like what you're saying is that, you know, if you work with the human, any resource you pass to the human is going to be passed on to the pet. We don't need to, you know, quote unquote, preserve the human animal bond or provide the animal more support if we support the person in a lot of cases.
Yeah, sometimes it's a person's problem. It's a people problem more than it is a pet problem. You know, so if we can refer them to one of our pet boarding facilities to do 3-day temporary boarding while they figure out what they have, that animal never came into our system. Sometimes we do have to provide emergency boarding. Sometimes, again, it does turn out to be an intake of a healthy cat or a healthy dog, but we know it's a healthy animal that has fully vetted, that has proof, and then we can place that animal on the adoption floor or send them to one of our transfer partners. So the animal does come in, but then we have a quick positive outcome for that animal as well.
And can you speak to any misconceptions that you may have run into regarding your approach in the community, whether it's something that hit the media or criticism from any of your stakeholders? Talk a little bit about that.
Yeah, the not taking in strays. Guilford County is not taking in strays. You can't take animals. We're obligated by law to take in strays. Take the strays there, dump them in the parking lot if you have to. They're obligated to take the strays. So we're taking strays. We've always taken strays. The challenge we have is that if we take way too many strays in one given day, then we run out of space. So we have to be creative on the space management. And so sometimes folks have to wait, but they don't want to wait because they're on their way to work. And they're like, they didn't want to help me, and now I'm at some other, you know, place, or I dumped the dog. So the most, I guess, negative feedback that we've received is on slowing down intake. But there's been a lot on our part to the community and to staff as well, is we have to share information of the why. Again, going back to it's not a no, it's just give me 15 minutes while I'll work you in. There was one point where our staff put up signs on the doors that we were closed and we weren't taking in any animals. And that was opportunity for me. So we turned the negative into a positive, and then we created the stray to foster. County administration at the time did not want to do the 48-hour foster piece thing. It was just a little too, you know, the liability piece. So what we did is that we did what we do today is we do an intake, we process the animal, we work up the animal, and then we send the animal out to that person who's willing to foster. But that all came out of a negative situation where it hit social media, where the media was calling us saying, why are we closed? When we weren't really closed, it was staff that got frustrated that day, and they put signs on the windows. And so we spun that and turned it into a negative media piece into this is what new program we've created.
Nice.
Yeah.
All right. Thank you so much. So I do have a question from the audience, from Gail. Gail asked, And this is for both of you, but I'd like to start with Dr. Jefferson. How is the Haas intake model different from capacity for care?
It's a great question, and it is, they're really closely tied together. And I think that when you're looking at capacity for care, it's all about being able to provide the right amount of care in the shelter setting for the animals that are within the shelter four walls. And that's something that is gaining more popularity in the community, that people just didn't understand that was a limitation of shelters, is that there's only so much you can do. And if you are bursting at the seams, your care level is going to go down. And so what we're, I think the way the Haas model fits into that is that shelters are really between a rock and a hard place. And we've done community surveying. I don't know if we've done a webinar on that yet, but I think it's really important to know that the community wants all of it. They want the animals cared for in the shelter. They want the animals to survive their shelter stay. They actually want people to receive assistance if they need it to keep their pets. And unfortunately, the shelters are not funded that way. They're funded to take in animals and do the best they can, and some may not make it out. And that's kind of the negative, unfortunate outcome, if you will. And so I think where capacity for care is trying to go is to try to help shelters understand how to calculate how many people, how much time they need per animal to actually do a good job. And where Haas is trying to go is trying to help move the nutshells around. There's really only 3 levers that are at a shelter's disposal. And one of them is to increase support to the community. So fewer animals come into the shelter. If you're trying to have high live outcomes and quality of care in the shelter. 2 is to increase euthanasia so that you can focus on a few and the unfortunate ones won't make it out. And 3 is to advocate for more funding so you can do it all. And I think that's what where Haas is going, is to try to help push some of that intake to support in the community. It is a lot more effective and more efficient in terms of the number of animals you can treat than taking them all in and trying to care for them in the shelter. That capacity for care is very expensive also. And then ultimately, we know that our system needs to change, and that's going to require more dollars. Does that make sense? And Jorge, feel free to.
Yeah, no, I agree with everything you said. You know, we have weekly welfare meetings and we discuss, you know, the capacity for care on a weekly basis, you know, and it's based on all those staffing, space, funding, resources. Outreach for us has been a huge success. So far this year, we've probably impacted, you know, individually close to 1,000 animals that probably would have been coming through our doors anyway. So we do a lot of outreach. We have branded our own outreach. We called it Mobile Pet Assistance Centers, MPAC, like impact, but the MPAC. And that has really created a huge relief for our intake, even though our intakes are up by a lot for this year compared to last year. Outreach for us has really been a primary focus. So when we're looking at what the Haas, you know, intake model and the capacity for care, we look at them both at the same, and we have that constant conversation and trying to balance them out.
Sweet. All right. So I'm going to ask us one of our questions, and then I'm going to start taking more questions from the audience. But I think this is an important place to ask this question. What would you want, either you, and we can start with you, Dr. Jefferson, what would you want the public or advocates to know about shelter intake that they probably don't know?
I think the biggest thing is a lot of what I just said, that the shelters are not outfitted to be able to do everything that the community wants them to do, and beating them up because they can't do it all is not productive. And we've got to get out of this conversation about just do better, just do better, just do better. It's more than that. This is an actual system. This is a business. This is a way of operating that affects many people's lives. The shelter workers, people that are on the, intake end and also on the receiving end of those animals. And, I was just looking at a statistic this morning about how older people, like in the 75 to 85 year range, are not real bothered by animals being euthanized in the shelters and sort of being in that impound facility. Yep. People younger than that definitely have a problem with that. And we need to harness that energy. Advocates could really be harnessing that energy and going to city council, advocating for the appropriate funding, advocating for the right programs to be in place, and really rallying behind the shelter instead of fighting them. If possible. Sometimes that's not possible, but I think most of the time it probably is.
What about you, Jorge? Do you have anything that you'd want advocates and stakeholders to know about intake that they don't already know?
For starters, just to make light of this, is that I don't want your donated pet, right? Like, this is not a donation. It's not a write-off. So don't come to intake to say, here, I'm going to make a donation of my, cat with 6 kittens. Really, I think I'm going to echo what Dr. Jefferson said. It's everyone thinks that every animal that walks in through our doors has all the resources in the world the minute they get here. We don't have those resources. We have limited staffing, we have limited space, we have limited funding. And I think it just boils down to, we're blessed to have a pretty large, we have a brand new facility. Our facility is only 2 years old. So we're good, but look at those municipal organizations that are still in very small, very, outdated facilities, and the staff is super small. And yet the community is expecting them to operate just like the shelter the county over. So I would encourage those stakeholders and those advocates to really take a look at their organization in their community and see what they are doing every day and what they're struggling with every day, and figure out a way to positively turn this negative message and go into, city council and county commissioners and county administration and just share how they can help and what these leaders should be doing to improve those facilities.
Yeah, that makes total sense. And in fact, I was in a shelter just recently that the pet support services were, some of them were actually offered by a nonprofit that was in the lobby of a municipal shelter. It was such an amazing partnership. And we definitely, for especially advocates and stakeholders, if there's ways for you to partner and to be that community-centric piece of the shelter, because Dr. Jefferson said it earlier, the shelter can't own everything. They're just not funded to own everything. And a lot of times their mission doesn't necessarily fit something as well as a nonprofit's mission and fundraising and what their focus is. So definitely that's something that would be a big help to shelters. Here's a really technical question from the audience. Sarah asked, how do you keep track of the animals that are in foster with the finders and the owners?
I'll take that one. So all those foster animals fall into our foster program, and our foster coordinator, with the help of a couple of volunteers, keep track of all those animals. So we have like the spontaneous fosters. Those are the good Samaritans who find the stray who's willing to foster either during the stray hold or longer. That individual automatically falls into our foster program. So we have a foster coordinator and a couple of volunteers that manage that population of animals.
All right. And another question from the audience. This is from an anonymous member of our audience. It's a little bit, they set it up with a little bit of a narrative, so I'll read that first. I feel like I've seen a transition away from using the term stray in favor of saying lost, instead to help encourage active community participation in providing immediate temporary fostering for a pet they've found. Is the Haas program also employing this terminology change to help shift public perception of a lost pet being someone else's problem / responsibility?
We continue to use Stray with all our communications. Every now and then we do have like the lost pet page, we'll use Lost, but the majority of our communication is Stray.
Yeah, I think it's a hard term to get rid of, but
Yeah.
the right word is
Yeah.
lost. We
Yeah.
know that the vast majority of dogs are going to have an owner, and cats almost always have a place to go. So using a word like stray really doesn't mean anything, but lost, it really does mean something, that somebody's out there potentially missing them and looking for them.
Yeah, you're exactly right. And being somebody who started in 1999 and got trained by people who, were working in the 70s and 80s. Yeah, stray almost gets collapsed with animals that don't have a home, animals that do have a home. It's just and so lost makes so much more sense, because it does give you that call to action to say, if this animal is lost, then we need to find their owner. And so, but it's like you said, and part of it, I know in a lot of places, that's still part of the ordinance, the definition of stray. So it is a hard term to get rid of. So, but yeah, lost generally is, I have found it been a better call to action for how do we look at these animals and really build a plan for them. All right, so next question from Terry Piefer is, do any of you all work with shelters in other states like New Jersey to guide them when they are struggling? Really struggling is what Terry wrote. And yes, go ahead, Dr. J.
Well, you can answer that one. The Haas group is helping.
Yeah, I can answer that one. Yeah. So in fact, our project, Terry, is just about that. We have 24 pilot shelters that we use as a way for the industry to see in real time shelters dealing with the same problems that all of us are dealing with that work in a shelter, and the solutions to some of those problems. But we want to do them, we do them in partnership with the shelter in a way that really speaks to that shelter's community and their stakeholders. And then we also have over 160 partner agencies that use whether it's our webinar content, our toolkits, which is on the Haas website that the staff will put in the chat, that allows you to take a look at some of the tools that, and the special thing about our toolkits is that they are a collaboration of over 300 industry professionals that came together during COVID that really looked at some of the biggest problems that we have in our industry, or actually in our work, and worked very diligently to come up with solutions and toolkits. And so you're more than welcome to look at those or to contact us directly for direction, and then also to collaborate with our, because we can set you up with one of our partner or pilot agencies who have implemented some of these things in a really effective way so that you all can cross collaborate.
And I'm going to add to that, Vincent, is that I am also part of, or we as an organization, are part of the Best Friends Shelter Collaborative Program. So we are bringing one of our sister counties as well. So really focusing on cats. So we're taking what we have learned through Hard Knocks here and then taking it a county over and sharing with them as well. Yeah.
All right. We have 10 more questions in the Q&A, so I'm going to keep reading our audience questions. Why do you think there's a hesitation to giving equal weight to solving people's problems as well as animal problems in the animal welfare industry?
Wow, that's a great question. So I have the same question myself pretty much every day. And for me, it's it's grown into a collaborative with our COC. Our Continuum of Care department is run by Guilford County. And I have partnered with them. In fact, they're so excited about this partnership that they've created their own name. So it's called PAWS, P-A-W-S. It's People and Animal Wellness Support. And what we are doing is really trying to figure out how we, animal services, can provide supportive services to those agencies, organizations that are providing services to humans. Whether it's a homelessness issue, mental health, medical. We have identified during the time and counts when these agencies go out and count how many homeless, for example, those who own pets are very hesitant to receive services or be willing to take services because of their pets. So we're trying to identify. So we're trying to tie this whole thing not only in our intake lobby, but also out in the field, is how do we actually provide support services for the pets, but really trying to provide those services for our human pet owners.
And, I'll add to that. And this is one of the foundations of Haas. I think it's because the model needs to be replaced, because our origin was picking up animals. That was the origin of animal services. And so it was so animal focused that even as we started to evolve, we would hire people that said that they loved animals, but they hated people. So we've gravitated towards the more animal centric, but it's really been to the animal's detriment, because we have collected so many of them, and at some point there's no plan for them. And so the idea is to really continue to leverage people, because we know that people are the most important resource when it comes to finding number one, the idea that, we are preserving the human animal bond. I really want us to back up to the point where we never interfere with the human animal bond to begin with. And we find ways to remove ourselves from that interaction between people and animals, and only be a resource to those people, and an aid to that circumstance, and not one that interferes or finds a place for that, to find reasons to take that animal from their pet owner. Let me see here. All right, next question. Can someone point to resources on weekly capacity for care rounds and the outreach model Jorge refers to?
Yeah, I would be more than happy to share everything that we've done for our outreach model, how we got there and where we're at. So what I can do, Vincent, and share it with you and Haas, and you all can forward it, share it with everyone. So yeah, we would love to do that.
We can share that with everyone.
Yeah.
And that was, go ahead. And Dr. J, did you want to add on to that?
No, that'd be great. I think that is awesome. I appreciate that very much. It's great hearing from people that are actually practicing it in that way.
Jorge, do you have a system this is from Kimberly Freeman. Do you have a system to deal with stray intake of healthy cats? And wondering if you have a return to field program and how that works for reducing stray cat intake.
No, our system is pretty much as they come in. So we do take in healthy cats. And it all starts at that phone call. If it's a animal control dispatcher having the conversation and trying to identify what the issue, like the root cause of the call. Sometimes it's a nuisance call. We'll send an officer out there who understands the cat behavior and be willing to work with the complainant. So this way we can do deterrence or take other avenues instead of just, we don't set traps. And that's one thing. We don't pick up, cats and traps either. But we try to work with the complainants. When it comes into the shelter, for those of you who live in North Carolina, understand this, there's a lot of challenges in North Carolina. Currently there's a state bill that's been proposed, so hopefully that will change. So we do not have a TNR program or return to field program. We do work with a couple of CAT program or CAT organizations like Rural Cat Assistance Program. They help us with managing some of these cat colonies or cat challenges that we have. We also have a commissioner who has blessed us with funding to do specific cat spay and neuter. So this is county funded spay and neuter resources that we provide our spay and neuter partners to provide with surgery. So for those folks who wanted to surrender a healthy cat, it might be their fear of the cat having a litter of kittens. They can't afford the surgery. Our staff is empowered to have the vouchers right there at intake, and they hand the voucher, and the voucher is immediately there, accessible to the person. They can call and schedule an appointment, and they can have the cat in surgery by the next day. So we have those partners. So there's a lot that we do for healthy cats. I think I need a whole hour just to talk about what we're doing for our cat population. We're also working with our sister counties, like in Alamance County. They have a cat program which has been very successful. It's called Mighty Mousers, and we are trying to copy that program. And it's basically bringing in healthy cats, getting them fixed at the shelter, but we have to unfortunately hold them 72 hours during the mandatory stray hold, and then we can release them back to where they were found. The bill that I was talking about is House Bill 511. And what that would do is change that state law of the mandatory 72-hour hold. So if we do get a stray cat coming in and the individual is okay for the cat to go back, we would be able to spay the cat the next day and then return the cat. So there's a lot of things hopefully in the near future within October, November, that hopefully things change for us.
And on our website, also, just so you know, Kimberly, we have tools and resources for TNR programs, and we can also refer you to some robust TNR programs as well. I wanted to get back to the panel. I wanted to get back to a couple of questions that just because we've got about 15 more minutes, that I think that especially as part of this the topic for this webinar, that I think I'd like for you all to answer. Dr. Jefferson, talk to us a little bit about how long do you think it takes to actually help people and the need to stair-step solutions?
Well, I think that it takes a lot longer than it does to have somebody fill out a form and then take the animal back to the back. And as we're trying to, we've finalized the first draft of the budget calculator, and it's really geared towards governments. We're hoping to be able to share that more widely soon. But we're estimating that, if you're looking for the owners of a pet, you should be estimating for your staff's time an average of 30 to 60 minutes per pet to be hunting down phone numbers, hunting down people on Facebook, hunting down, going out and putting up signs, going and talking to neighbors around where that pet was found. Not very many of us do that. And so this is a transition that's not going to happen overnight because there's just simply not enough resources. But the work there's no tech that's going to solve that. It's going to it's a human that has to do all that groundwork. Some ways to expedite that is potentially using volunteers. That gets a little bit dicey in the government realm just because of privacy and not being able to share names. But yeah, it takes more work, just like it takes more work to care for an animal than it does to euthanize them. And so
yeah,
everything we're doing is for the betterment of animals and people. And we need to start getting real about what that means and making sure that we're preparing.
Yeah, I mean, it's like you said, I mean, you can't, there's no way to skip any steps. I mean, especially when we're talking about life saving. And I'm sure that from the pet's perspective, they definitely don't want us to skip any steps, right? And well, and from the human that loves that animal, the exact same thing. So I have a question for both you and Jorge. What would you want shelter directors to know about what real Haas intake is?
I think we covered most of that, at least on my end.
Okay.
Jorge, what do you think?
I think is you have to be willing to challenge the norm. I mean, I think that's what we've been talking a lot is being innovative. Vincent, I've told you this many times, it's being comfortable, being uncomfortable,
Yeah.
and having those uncomfortable conversations with leadership, with county leadership, or the, you know, whichever department you report to, whomever you report to. And that's been for me for the last, you know, 3 years pretty much, has been having those conversations and breaking the norm of why we need to do more managed intake. What does that mean? Why can't you just take the animals in? Because they're the ones who receive the complaints, and then we have to resolve it. And it's having that conversation of helping them, meaning leadership, understand why we're changing. So I think as a director, one for me was accepting the fact that we needed to do things differently if we want to change. And then two, that I knew that I was going to have some uncomfortable conversations of explaining the whys of why we were shifting.
All right, so we still have 15 questions from the audience. Let's talk about, can you speak to how this intake model helps solve systemic issues? It's hard out here for so many communities, and our group just wants to move the needle even a little bit.
Yeah, I can start on that one. It's this is a systemic approach. Haas that's the whole point of it, is that animals are not in a silo in our communities. People are always connected to them in some way, and our system has been set up to keep them separate, to think of them separately and to treat them separately. And when we look at the issues that are most important to elected officials, those issues are about people, and animals are always going to be at the bottom of the list. That's just inherent to the work that we do, unfortunately. But the people connection is critical. And so something that's really resonated with policymakers that I've spoken to here in Austin is the idea that they all know, policymakers know, they don't need to read studies. They know that people seek help for pets before they do for themselves. And if there is a real support service at the animal shelter for people, they have the opportunity to potentially save so much money on the back end by preventing a catastrophic event in that person's life that might push them over the edge. And we know it does. There's been, we've done surveys here in Austin, happy to share information at a later date, but surveys with our homeless coalitions, and the caregivers rank the loss of an animal from somebody who's experiencing homelessness as catastrophic to their mental state and to their ability to get back on their feet. And so I think the more we can talk about it as a systemic issue, the more support there is for helping people and helping animals, period.
Yeah, I know I add a little bit to that. It's all about the coordinated entry, right? When I'm having these meetings with, you know, all these county agencies working on, for example, the homelessness issue, it's all about coordination, and it is a huge system. And we have been excluded from that system for so long that us coming into the conversation, it's almost for some shocking and others very exciting. Like, oh my God, I could have used you yesterday, right? So yeah, we in Guilford County are trying to approach it as an entire systemic countywide. We have three different entities, meaning the city of High Point, city of Greensboro, and then the county of Guilford. So it is a little challenging, but we are doing exactly what Dr. J said, just looking at it as a whole, not just the pets.
So I have another question that I think to help us kind of wrap up a little bit, and we'll take a few more audience questions as well. Dr. J, can you, and also you, Jorge, but we'll start with Dr. J. Can you speak to why you believe there's such a poor first impression of the Haas model and what we've done to change that misconception?
Yes, that's a great question. It's a, and I think the whole purpose of opening this dialogue is to help get past some of the misconceptions that are out there. And some of those misconceptions are people made, specifically me made, and other people that were involved early on in Haas, and not out of a desire for the wrong programming to get into place, but it's just the nature of trying something new and how you speak about it. And the way that we were speaking about it at the beginning really revolved around the goal being decrease intake. And really what we should have been saying is increase care by doing X, Y, and Z, because that was the whole intent. Is it's not to turn away animals. I think the language of saying one of the goals of Haas is to decrease intake by X%. That's not enough on face value, and unfortunately, that's been the phrase that people have run with and used to say, okay, well, that's what Haas is just turning people away. Absolutely not. That was not ever what it was intended to do. When COVID happened, shelters shut down. Shelters had minimal inventory of pets, and people were able to actually do a good job. And what we wanted to do was preserve that by taking advantage of the things that were coming to light about how much people wanted to help and how much people didn't want to be separated from their pets. Like I said at the beginning, we didn't know all that. We didn't know that as an industry, which sounds crazy in 2020, but we didn't know. And so leveraging those things to make that a permanent reality for us is exactly what we were going for. It wasn't, the point of Haas is not to decrease intake. The byproduct of Haas is decreasing intake.
Yeah, for us, it was just Haas helped us slow down and think, really trying to solve the issues and not just do what we were always doing, is just sign here and thank you, and sign here and thank you, is really pausing, stopping. How else can we look at this? How else can we, what other resources can we provide? So for me, in short, it was just giving us an opportunity to slow down that intake process and really think about the bigger picture and what role we were playing and what role we want to play in the future.
I have a really interesting question from Sarah Jones. She asks, how do you track the impact of animals that never enter the shelter? How does the shelter take credit for that?
A tough one. I don't know how Jorge does it, but I know shelters really struggle. There's some softwares out there that you can use, but it's an area we really need to do. There needs to be more tech support. There needs to be more follow-up time. It's just people time for follow-up and all that. But Jorge probably has a better answer.
Yeah, I agree. Outreach is we are now starting to get organized. So we are using our shelter management software to help track people. We're not putting those animals into our system, but we're using it to help us track. We're going old school Excel spreadsheets and charts, those type of things. That's what's helping us, track our numbers. I wish there was a better way, because we are and have been increasing our outreach efforts, and these are focused outreach efforts, right? This isn't a mass, rabies vaccine clinic for the whole world to come to. These are based on calls or meetings that I've had with commissioners and their districts and areas of needs that based on GIS data for calls of service. So we also track our work based on the spay-neuter vouchers that are being claimed, right? So, or redeemed. So our partners give us the vouchers, and then we also know which vouchers have been, actually redeemed. So this way we can also follow up with those folks. So we're still learning at that. Hopefully we can create a way that we can really follow up and track these individuals.
Yeah, and can I add one last thing
Yes.
to that? I think we really just need to rethink how we're tracking everything. And I think ultimately it comes back to the calls for support from the community. Probably needs to be our kind of, I don't know, the barometer of how your community is doing, and then trying to track those outcomes of those calls and animals. And I think that caring for them in the community is a huge piece of that. But yeah, anyway, it's all connected.
So yeah, thank you both. And you know, what I'd like to see eventually is just like we publish a life-saving rate for the shelter, to see a community life-saving rate published, so that the community understands and knows how much work that they are already doing, and how many lives they've saved, and give us that common ground to be able to celebrate with our stakeholders too. So, okay, we're at, whew, man, wow, I feel like I was swimming and now I'm coming up for air. This was terrific. So we still have a bunch of audience questions. We promise that we'll get them all answered. Jorge and Dr. Jefferson, we will probably be sending you questions to answer for the audience, because there's so many good questions, and there were some that were specifically directed to the two of you. But I wanted to say to everybody, thank you for joining us once again. Remember, go get your Haas t-shirt. Also, tonight's webinar, if we didn't get to your questions, like I said, we will make sure that we get that question answered for you. In a moment, you'll get a brief poll for this webinar, and so please take a moment to complete and let us know what your thoughts are about tonight's webinar. The chat told me a lot about what your thoughts were. And then also a reminder, our next webinar event is August 17th on the topic of community-centered field services. So my team will share the registration link in the chat, and also keep your eyes out on your email for an invite to come to that. Thank you everybody for being here. This was a terrific night. I think this is my favorite webinar so far. And I really appreciate all of you being here tonight. And thank you, Dr. Jefferson and Jorge, once again.
Thanks.
Thank you.
Yeah. Bye. See y'all later.